Tier 1 is orthopedic and neurosurgery practice here in the Upper Cumberland area that provides a full range of orthopedic care, including specialty care for a range of conditions, including hip, knee, shoulder, foot and ankle, spine. So really a one-stop destination where we can take care of all the orthopedic needs of the area, which I think is a real benefit to the community to be able to have that level of specialty care and accessibility very close to home. I went to medical school at the University of Illinois and then went on to do my orthopedic training at the Mayo Clinic, and then finished that with a fellowship in adult reconstruction, which includes hip and knee replacement and revision type procedures at the Florida Orthopedic Institute in Tampa, Florida. The type of patients that I treat have a variety of conditions related to the hip and the knee, specifically as it relates to joint replacement, whether that be first-time joint replacement and minimally invasive techniques like direct anterior hip replacement or partial knee replacement, to more complex procedures for patients that have had previous surgery, whether it be previous trauma or previous joint replacement that has failed for a variety of reasons. So really taking care of a wide range of conditions related to hip and knee joint replacement, whether it be the simple first-time surgery or the more complicated revision type procedure. What really drove me to orthopedics was the ability to have a direct impact on the patients that's very measurable and demonstrable. So when I see a patient in the office, they're clearly struggling most of the time, having difficulty walking, struggling with pain. And in the course of the treatment period, you can really see a dramatic difference for most patients in how they're able to function even in their day-to-day life and return to their activities. And that part of it really drew me to the field. A lot of specialties, the differences are over a much longer time frame. They're harder to see, but with what we do, it's very easy to see the patient's improvement over a relatively short period of time. I'm originally from a small town in central Illinois called Charleston, Illinois. It's in some ways it's similar to Cookeville. It has a small university there, Eastern Illinois University. My father and my grandfather were both professionals in the area. They're both dentists, and so that was where my mom had grown up. It was a relatively small town, about 10,000 people. The closest big city was St. Louis. Champaign was a little bit bigger, about 100,000. That was about an hour away, but that was where I grew up. We were really drawn to this area for a variety of reasons. It's very similar to an area where I grew up as far as the makeup of the community and the kind of close-knit feel and vibe that it had. It also had a variety of amenities that were either right here in town or close by, so that you really feel like you get the best of both worlds. And the people here, very similar to where I've been in the past, are just easy to take care of, really down-to-earth people with reasonable expectations and really just appreciative of good care and good service.